Greetings friends, it's Victor here and welcome back to another video. I am now officially 9 months post-top surgery, and so I'm here to just share my results at 9 months. But before we begin the video, you know the drill, please do make sure that you're subscribed to the channel and like the video. Thank you very much. Alright, without further ado, here are my 9 months post-top surgery results. Gonna do the take off the shirt thing, because that's not awkward at all. So I do have on here, this is Sika tape, which is a scar treatment. They're just like these silicone tapes that very conveniently just go right over the scars. They're pretty flexible, and so I found them very comfortable, and I have also noticed that my scars are much softer after I've used them, as well as the surrounding skin, so I can definitely tell that it helps the skin slash scar just be softer in general. And it also, like, at least in my opinion, I think it makes the scar, like, more flexible, kind of along with that softness. All right, take off this other one, too. All right, here you have it. These are what my results look like 9 months after top surgery. So I had top surgery on August 12th of 2020 with Dr. Neil Zemmel. It was a double incision top surgery with the free nipple grafting, and this is what we've got. Also, please do forgive my horrendous farmer's tan. I tend to be a relatively active person in the summer, and I just was not thinking about horrible tan lines when I went out with sleeves on the other day. So here we are. It is what it is. For the results themselves, they are not perfectly symmetrical, obviously, and I have noted this before. That does not appear to be changing. It is kind of like the scars are where they are, the nipples are where they are, they're the sizes that they are, and that is just a fact of life at this point. Now, specifically addressing changes since my 6-month post-top surgery update, there aren't really too many changes other than last time I had noted that this nipple was like really hard and rubbery, and this one was like very soft and squishy. Since 3 months ago, this nipple has become much softer to the touch. It is not nearly as soft as this one, but it is much less hard and rubbery for the most part, and so that is definitely changing. Aside from that, I do think that the scar itself is getting softer, but it is not getting less raised. So it is like raised out away from the rest of the skin throughout most of the outer edges of the scar, and so like I can definitely feel it if I were to like run my hand down like this. Like I can feel like a pretty clear like bump. Toward the center, it is much smoother and more flush with the skin, but it is definitely not completely flat in most places. There are a couple places where it's completely flat and I just can't tell. At this point, I have been very careful to keep the scars out of the sun for the past 9 months, especially now that it's getting to be the summertime and it's getting warmer. I'm still ensuring that I have my tape over it and at least one layer of clothing anytime I go out in the sun. I'm starting to wonder if that's maybe not enough and I should double up the layers, just because like I did notice there's a little bit of flakiness here that might indicate like sunburn or something, but I haven't been outside in the sun with any fewer than the 1 layer of tape and an additional layer of clothing. It's also perhaps worth noting that I had top surgery prior to starting any testosterone, and since having surgery, I have started on low-dose testosterone. So right now, I am about 4 months on low-dose testosterone and 9 months post-top surgery. In general, with being on low-dose, I have not noticed much like hair growth or anything. Maybe a little bit more muscular definition, but not much, to be honest. And so this is more or less what I would have expected to see, even if I had not started hormones. Yep, so for the side view, in my opinion, pretty flat, like in a good way. Like any protrusion for the most part, I feel like is because I do, do chest press at the gym, and so I am trying to like maybe bulk up the pecs a little bit. But in general, like feeling pretty good about everything that's going on here. For those of you who have watched my previous videos, you will know that I am multiracial, and so I do have both Asian, specifically Chinese, and white genes or, heritage or whatever, and so I am kind of seeing, I think, some of the like Asian genes that tend to be prone to hypertrophic scarring, especially like obviously along the scars. Okay, I think those are all of the updates that I have for this go around. So if you have any questions, please let me know. I'll be happy to attempt to answer them. But yeah, this is 9 months. This is 9 months and we're feeling pretty good. All right, thank you for watching. Until next time.